Hello, I'm Fred, and this is Winona Davies with The Wholesome Life, and we empower you to rebuild your own wellness and the wellness of your families. This is Herbal First Aid, part 1 of 2, so that you can have an opportunity of knowing what plants to use when you're in a first aid situation.
The first most important principle of herbal first aid is first, do no harm. Beyond the simple basic things of not moving someone who may have a neck or back injury or those kinds of things that don't do harm, it also means that when we use herbs and plants for first aid rather than using other things, we are much less likely, in fact, we are not going to cause harm. Herbal first aid plants are safe plants. This means that they won't harm someone. They will only do good, and if it's not needed, the body will simply not use it. If you get to know some of these plants, and there are not a lot, there are relatively few plants that are good for first aid, get to know them and use them what they're intended for and in their whole plant form, then the body will use them and let go of anything it doesn't need. You really can't do harm when you use whole plants that are known for their safety and known for what they can do.
We're going to reference from a book called Herbs to the Rescue, an herbal first aid handbook by Kurt King, who is a master herbalist, and his experience is wide in how to use plants out in nature, but also those same plants for herbal first aid in a house or urban setting. So when you see HTTR page number, that's from Herbs to the Rescue, and the page number that references there. In parts 1 and 2, we're only going to cover a very small percentage of what's in this book. And so I'd suggest getting the book and getting to know some of those plants even in more depth than what we'll touch. We just want to touch on a few of the most important things that we've seen over and over again and that are really critical to you and I to do.
The ABCs of first aid are pretty much the same no matter what approach you take. A is for airway. Make sure that the airway is clear. This means you check for breathing. You put your ear near their mouth and nose to hear whether they're breathing. You put a hand gently on the chest to see if it's rising and falling. If the airway is not clear, then you go to B for breathing. You want to lift the chin to clear the throat if the tongue is obstructing the airway and not allowing them to breathe. You may want to seal the nose and put your mouth over theirs and force a little bit of air into their lungs to get it started. If that doesn't work, if the chest doesn't rise when you do that, that may mean that there's an obstruction and you need to do the Heimlich maneuver to remove that obstruction from the throat. The third thing is circulation, and we'll be talking a lot about circulation, but that just really means that it's important for you to note whether blood is flowing appropriately to the limbs and to the extremities and to the body in general, whether hands and feet are blue or looking as if they're not getting enough blood circulation, paleness of the skin, that sort of thing.
Maybe you've done or practiced the Heimlich maneuver before. It's pretty simple, and as you can see from the graphic here, it's just a matter of putting a fist together into their stomach and then pushing hard enough to force air out the lungs. And we've actually had experience with that. We've had a time when we were at a restaurant, a piece of food got caught, and I noticed there was no ability to answer my question, and I think you were grasping a little bit at your throat. And we did the Heimlich maneuver, and the end result is it popped out, but it does leave some trauma. If you've ever been through that before, you know that not being able to breathe leaves you pretty shook up. And so what do we do to clear trauma? Well, talk it through, do some deep breathing, and maybe one of the teas like peppermint tea or chamomile tea that calm down the body again to clear that trauma and get back to normal. Stay with the person, make sure that they're doing fine, and make sure that that choking or the airway is clear. How do we prevent choking? Well, we've talked in other sections about chewing your food well. Drink your solids and chew your liquids is what Dr. Christopher always said. It means to add saliva to your liquids and to make sure your solids are chewed well enough that they're actually an applesauce consistency while you're eating. And so you're not trying to swallow whole food and get it to go through a throat that's really not made for whole food, because it doesn't digest either. And that way we can make sure you don't end up choking. We can accomplish this by simply slowing down while we're eating, and then taking special care with dry things such as nut butters or meat or things that don't chew easily and that we're tempted to swallow quickly.
Asthma is a concern. If you've ever been with someone who's experiencing a severe asthma attack, it can be very upsetting and frightening. There are some things that are very helpful for asthma attacks. Brigham tea, or an ephedra, local ephedra plant, is a wonderful plant for asthma. You can use it both as a breathing treatment and to drink it. Mullein tea, and we've talked about mullein in other places, is also a wonderful lung rebuilder and bronchial dilator. And we can also remove the cause if there is an allergen that's creating the asthma. That's important to remove that as quickly as possible too. Using Brigham tea as a breathing treatment is a very powerful tool. My own youngest son had severe asthma as a child, usually cold-induced or exercise-induced, when he was about 12 years old, and I learned about the properties of Brigham tea. One winter when he was suffering severe asthma, I put filtered Brigham tea into his breathing treatment, and he immediately got better and never had another asthma attack after that. He even ended up going into the Marines and completing the final challenge of basic training, which is known as the Crucible, with pneumonia, which prior to this, a cold would have put him into full-blown asthma when he was a child. But with full-blown pneumonia, he was able to complete the Crucible and have no problems with asthma, and has never had problems with asthma since then. It's an extremely powerful treatment.
We mentioned that mullein does help to repair the lungs. Also, anything that'll calm down the breathing and calm the body's response. Peppermint, chamomile, kava is one of the favorites. Catnip or spearmint as a tea. That's just very helpful to calm down the breathing and give them a chance to have that repair done. Mullein as a repair for the lungs. Lots of tea or capsules work just fine and be consistent for enough time for their lungs to repair. So let's talk about the circulation part of the ABCs. What do we do for external bleeding? What do we do to stop external bleeding? You've probably heard put direct pressure on it, especially if there's pumping blood coming out of an artery. It's important to have direct pressure on it. There's actually a faster way to stop massive external bleeding. And maybe you got the clue from that picture there of the cayenne pepper red plants. That cayenne pepper is the faster way to stop external bleeding. You can put cayenne pepper directly on a cut or a wound, pack it in, and the bleeding will stop.
And that's true even when the bleeding is massive. I was acquainted with a story of a man who had someone he was with working with a knife, and the knife slipped and cut the femoral artery, which is in the groin. And by packing it with cayenne, they were able to get him to the hospital and save his life. The hospital personnel could not believe he was still alive because they were kind of out in the middle of nowhere when this happened, and it took a while to get to the hospital. So the fact that the cayenne was packed immediately into the artery, they said saved his life.
So what do we do for shock? Maybe my own story would help a little bit. A few years back, I fell 20 feet out of a pecan tree while we were helping a neighbor pick pecans, and I had climbed up the tree and was shaking the branches up there. I wasn't familiar with pecan trees and didn't know that a pecan tree gets very brittle when it's in the winter and when there's no leaves on it. And the 6-inch branch I was standing on broke right off. The other 4-inch branch I was holding onto with both hands also broke off at the same time. And the pecan tree had enough of me shaking it, and it decided to drop me out of it. Well, the one I was standing on was about 20 feet high, and I fell all the way to the ground and rolled over. The wind knocked out of me. Thought I'd be able to get moving again really pretty quickly, but realized after a few minutes that I was starting to black out, that I was going into shock. And the one thing that I have on me all the time is a small packet of cayenne pepper, just a small plastic bag in my wallet, 2 teaspoons worth of cayenne pepper powder in it. And I said, Winona, take this and get me some water, and so I can get it down, because I'm definitely starting to black out. I'm starting to see white. Well, she did. She got the water and put the cayenne pepper in it, and I drank all of it down. You might ask, is that hot? I didn't even notice it. I didn't notice at all that it was hot in my mouth. I just noticed that within a few seconds, I wasn't seeing stars anymore, and that I was able to at least stabilize. So what we found out was that there was internal bleeding after we'd gone to the hospital, and that the internal bleeding had bled out about a quart of blood from some broken bones in the pelvis area that had severed some blood vessels. And so the fastest way to stop shock, yes, cayenne pepper, but that's also how you stop internal bleeding. And that's how the shock stopped, is that the internal bleeding stopped and it balanced the blood pressure.
You might be thinking that we're overdoing it on the cayenne pepper, but it's one of the most powerful first aid herbs out there. Cayenne pepper has saved more than one person in our own circle of experience and life from heart attack and stroke.
Yeah, cayenne pepper saved my dad's life. He had a neighbor out with him one day, and the neighbor recognized that he was fading quickly and ran in and got cayenne pepper and ran back out with a glass of water with cayenne pepper in it and had him drink it down, and it stopped the heart attack. The same happened with a neighbor of ours who was had all of the symptoms of having a heart attack. And we don't diagnose, so I can't say that it was a heart attack, but she reported all the symptoms, and that's what we said before. It's safe to use. It won't hurt to give cayenne pepper a teaspoonful in a glass of water, or 2 teaspoons full or more in a glass of water. It immediately stops a heart attack because it balances the blood pressure all the way through the body and lets the heart continue working the way it's supposed to work. How do you repair the damage from a heart attack or a stroke?
How do you recognize a heart attack?
How do you recognize a heart attack?
Hopefully you've learned some of the symptoms of a heart attack if someone is having one. It may be chest pain. That's the most common and obvious one. But especially in women, it may not be. It may be shoulder pain or
in
back.
Left arm.
Yes, and arm and back pain, upper back pain. Or it may simply be shortness of breath and a feeling of not being able to continue going.
I've heard people describe it as an elephant stepping on their chest. Yeah, extreme tiredness. Cayenne is also the repair for that, for both a stroke and a heart attack, because it actually repairs the blood vessels and gets enough blood pumping through to those areas that have been shut off. And so it's the most effective repair for those. Speaking of stroke, do you know anyone that has had a stroke? Do you know how to recognize a stroke?
I'm not sure I do.
Well, but we have helped someone with a stroke, haven't we?
Mm-hmm.
You want to tell that story about your dad?
My sister called one night to tell me that my father was in the hospital after having had a mini stroke. We grabbed cayenne tincture and ran out the door and got to the hospital. When we arrived, my father was hooked up to a number of machines, one of which was a blood pressure monitor, and his blood pressure was sky high. It was unbelievably high, which was really surprising to me because he's always been pretty healthy. He's a careful eater and he's not overweight in any way, but his blood pressure was through the roof. And so we gave him a dropper full of cayenne tincture in a glass of water, and his blood pressure started to come down. Once he came home from the hospital, he began taking cayenne with meals, and his blood pressure has stayed normalized since then.
We've had other neighbors that have had all the indications of having a stroke and again used cayenne pepper, and within just 30 seconds it calms it down and stops it. Now, contraindications when not to give cayenne pepper. Well, if you're taking a blood thinner or blood pressure medication, cayenne may work on the same areas as that works, and it will bring down your blood pressure. So you might want to talk to a doctor before you start taking cayenne pepper if you're on other medications. Or you definitely would want to use muscle testing to know what your body needs for everything that you put in your mouth. And as I mentioned before, repairing stroke damage is done with cayenne. Cayenne increases the blood flow to the brain and helps with that repair. There are several other plants like ginkgo biloba and goticola, some of the plants that repair the brain that help with that repair. While we're talking about cayenne balancing the blood pressure very, very quickly, I want to tell a story about a young man who was having reoccurring nosebleeds. We were acting as mom and pa on a trek, and this young man came to me one day with his nose just streaming. He couldn't get it stopped. It'd been that way for a while, and he asked what he could do. It was hot out. He hadn't been drinking enough water. You know, the typical things that a teenager would be challenged with. And I asked him directly, I says, are you willing to have your mouth pretty hot to get that nose to stop bleeding? And he said he wanted the nose to stop bleeding. So I gave him cayenne pepper in water. And before he had got it all down, even his nose stopped bleeding, because it starts absorbing actually right in the mouth. And within a few seconds, it was completely stopped, maybe 15 seconds. So he ended up drinking 2 or 3 more glasses of water because it was hot in his mouth, but the nose bleed was stopped completely. And I would use it on anybody with a nosebleed. The other thing it works on, and it's not in this presentation, is it usually works on migraine headaches because it balances the blood pressure. We've had several clients that have used it for migraine headaches, and they absolutely appreciate what it does there. One last story. Teenagers always worry about acne. You can ask, how does cayenne clear up acne? Well, I'm not going to answer that question right now. I'm just going to tell you a story. My daughter had friends that were using cayenne pepper to clear up their acne. And she thought that would be a great idea because she was frustrated at a little bit of acne. So she started taking cayenne pepper every day. And one day she took the cayenne pepper as she was running out the door without breakfast and with hardly enough to just get it down. And you might guess what happened. Cayenne on an empty stomach is not pleasant, and especially if you don't have any ability to correct it because you just ran and caught the bus. She refused to take anymore because the pain was so high. So a little bit of advice, especially for acne, if you're taking it each day, take it with a meal. It shouldn't be taken on an empty stomach.
Or at least with plenty of water. If you're using it in a first aid situation, that would be why you want to put it in a glass of water. You want there to be plenty of water so that you're not causing serious stomach upset.
Yeah, when we gave it to Winona's father, we gave it with no water as a tincture straight in his mouth. He immediately drank a whole liter or 2 and kept drinking everything we could give him for a while because it was so hot.
But that water helps prevent stomach upset.
On page 100 in Herbs to the Rescue is a list of 80 different things that cayenne will do, all with one herb. We're not going to talk about other things that it will do right now, but it's probably worth doing a review of that. Cayenne would be one of those plants I keep with me all the time. It's the only one I carry with me in my wallet all the time. And because it has so many things that it will do, and especially in life-saving situations. So that's all we wanted to cover in the first segment of Herbal First Aid. And you notice that a lot of that was cayenne. Well worth learning about. Thank you, and we'll see you in segment 2.